Cancer diagnoses are on the rise, and innovation is critical to accommodate the growing patient population.
When the patients walk in through our door, they should not be worried about everything else, but just to get better or to get treatment, right? Because everything else is our responsibility.
Welcome back to Cancer Buzz. I'm your host, Summer Johnson. ACCC recognizes the importance of innovation in delivering high-quality cancer care, and it celebrates forward-thinking cancer programs that achieve progress by presenting them with an ACCC Innovator Award. Each year, the winning programs are showcased at ACCC's National Oncology Conference. It's an opportunity for oncology leaders to learn from one another face-to-face.
I think in general, there's a lot more collaboration and coordination between our teams.
That's Liza Rodriguez from the Fox Chase Cancer Center. Their team developed a new care model to meet growing demand, earning them a spot as one of ACCC's 2025 Innovator Award winners.
We are growing rapidly as a cancer center. We actually are onboarding a lot more faculty in our clinics. Many of the patients would love to be seen here at Fox Chase, and we really did not have a good structure in place to be able to accommodate all of that growth that we have. And the model in the ambulatory care setting at that time was such that, we bring in physicians, we expect to have a lot more patients, but then we really have not looked at the staffing and resources that's really needed to make things successful, right? And there are also a lot of process issues that really leads to a lot of non-value added work to our teams, which then also adds to a lot of delays or, care coordination issues. And so my team and I really sat down and decided what can we do in order to really fix the root cause of all of these problems, and then move forward with some solutions so that we can actually sustain a lot of these improvements.
How have providers been responding to this new care model?
So, from the service lines who we actually stood up in this model, we actually have heard a lot of positive feedback. First and foremost, we actually defined the roles of our certified medical assistants. We also defined what are the roles for our nurses, and we're slowly integrating and aligning with the navigation team, with the phone triage team, right? So I think in general, there's a lot more collaboration and coordination between our teams. The nurses now have a lot more time actually to spend with the patients and really even look at the visit continuum for the patients and looking at what are the things that is needed for their next visit. For example, are all of the diagnostics or testing that needs to be done completed? Are the results available in the chart so that the physician can actually have something to work with when they do speak to the patient for further defining what the next plan of care should look like for them? So really, it's role clarity, role delineation, and just more effective care coordination.
What do you think drives your cancer center toward this kind of creative problem solving?
I am fortunate to work in a place wherein all of our team members are really connected to our purpose, right? All of our staff, from our frontline staff to the executives to the different support services, truly have the patient front and center. And I think that really drives a lot of our passion towards improvement, passion towards making sure that the care that we deliver is exceptional, passion towards making sure that when the patients walk in through our door, they should not be worried about everything else, but just to get better or to get treatment, right? Because everything else is our responsibility. And at the end of the day, while I'm not necessarily in the front lines, I really take comfort in knowing that I can make a difference in terms of how we actually are delivering care for our cancer patients.
What makes your care model so unique and sets it apart from traditional models?
Yeah, I think what's really different in our model is that we actually are investing resources at the beginning, right? So it actually is not how traditionally executives have looked at things, right? It's always trying to contain the cost and trying to really do more with less. Our model actually necessitated us to actually add more FTEs or more nurses and more MAs, right? Because the way that we're really looking at this is that if we invest the resources up front and we are efficient and the team feels that they have all the time, the tools and resources that they need in order to be successful, then we are actually preventing dissatisfaction of the staff or preventing dissatisfaction of the faculty, right? And if you really think about it, there's a lot of dollars that are being spent on wellness, right, for physicians or nurses, a lot of dollars that are spent in terms of, okay, how do we address the burnout that our healthcare workers are feeling? But if you really think about it, investing upfront and making sure that they do have the resources so that they are effective and efficient and satisfied with their workflows and they know that they're delivering the care for the patient, I think that would actually reduce the dissatisfaction and reduce the burnout of our healthcare workers, right? And so I think that is fundamentally the difference in the approach that we have taken compared to how we would have addressed these issues in the past.
Liza and her colleagues from Fox Chase Cancer Center will be presenting more on their program at the 42nd National Oncology Conference this fall. You can visit the link in the show notes to register for the event. That takes place October 15th through the 17th in Denver, Colorado. You can visit the link in the show notes to register for the event. You will not want to miss out on that one. Thank you for listening. From the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.